Hi there, how are you doing today?
Oh, I'm doing well.
Glad to hear that. So, if you could for us, please just introduce yourself. Give us your name, your title, a short bio about yourself, your credentials, and then state the title of the article you'll be talking about today.
Sure. My name is Rhoda Owens, and I am an associate professor and the interim PhD in nursing program director at the University of North Dakota College of Nursing and Professional Disciplines. In addition, I am the current president for the International Society for Professional Identity in Nursing. And the title of our article is Professionalism and Professional Identity Clarification Will Strengthen Nursing.
Amazing. So, could you briefly give us an overview of why nurses should read this article?
Sure. The article provides a clear discussion on the similarities and differences between the concepts of professionalism and professional identity in nursing. By reading this article, all nurses and even nursing students can obtain a better understanding of these two very important concepts. The definitions for professionalism and professional identity in nursing used in the literature have evolved over time. We define professionalism as quoted by Finkelman as the conduct, aims, or qualities that characterize or mark a profession. In addition, we define professional identity in nursing as defined by Godfrey and Young as a sense of oneself and in relation to others that is influenced by the characteristics, norms, and values of the nursing discipline, resulting in the individual thinking, acting, and feeling like a nurse. Professional identity in nursing also includes the four domains of values and ethics, knowledge, nurse's leader, and professional comportment.
So, what made you want to specifically write an article on this topic?
Well, I worked with a group of writers that are members of the International Society for Professional Identity in Nursing. And we felt an article was needed to help readers obtain a better understanding on how the process of becoming a professional nurse and forming the nurse's professional identity is a transformative process that flows from the nurse's overall personal and overall identity. The article includes the transformative model that further explains this process that we developed. Also included in the article is a model that we developed that depicts the amended Miller's Pyramid that outlines how to assess nurses as they transform from novice to expert throughout this process. This process must be supported in nursing education programs, all practice settings such as academia, healthcare settings, and any setting that the nurse works. It is a socialization process through extrinsic and intrinsic means that must also be facilitated and supported as the graduate nurse transitions to practice. Over time, the nurse does reach a milestone where the nurse can say, think, act, and feel like a nurse, or I am a nurse. Nurses in all practice settings must be able to embody, embrace, and model their professional identity, which can have a positive impact on their workplace satisfaction and environment, patient safety, and patient outcomes. However, for nurses to flourish in their professional identity, their work environment must support their ability to do so. It is important for nurses, including administrators in all practice areas, to become knowledgeable about why professional identity in nursing is essential and important. Lastly, we also include implications for education, practice, and research.
Awesome. So, if there were 2 to 3 things that you'd like nurses to specifically take away from this article, what would those 2 to 3 things be?
Sure. First would be number one is all nurses and students must obtain a better understanding of how to form and embrace their professional identity. Second, when nurses are able to embrace and flourish in their professional identity, they can have a positive impact on workplace environment and satisfaction, patient satisfaction, safety, and outcomes. Lastly, all nurses and students need a workplace environment that supports them as they form and flourish in their professional identity.
Amazing. Well, thank you so much for sitting down to talk about this with us today. We really appreciate you writing your article for American Nurse and to talk about it with us today.
Sure, I am happy to. It's a topic that I'm very passionate about and do a lot of research on. So thank you very much for allowing me to discuss my article.